Okay, we'll get started. So thank you everyone for joining us. This is the Children's Hospital New Orleans Return to School Support Town Hall. This town hall is offered in partnership with the Louisiana Department of Education, an organization that we're very proud to be partnering with. Today we're going to review an update on COVID-19 in Louisiana, and then we'll jump into guidelines for teachers and nurses and how it specifically pertains to their experience in the educational environment. We'll end on a scenario review of potential situations that could arise, and we'll reserve most of the time at the end of the town hall for open Q&A. And my name is Kimberly Buckingham, and I'll be our moderator today. So anyone that has questions or concerns, please enter that information into the chat, and I'll make sure to condense those questions and pitch them to our speakers throughout our discussion. As a reminder, this town hall is offered as a larger series. The series has been taking place throughout July and will continue through August. We're going to reassess once the school year starts what that cadence looks like moving forward in case this can be an additional resource, so stay posted on that. And each session will be recorded, so you can access this afterwards via the Department of Education's website as well as the Louisiana Believes YouTube channel. Another reminder for the resources that we'll be referencing throughout our conversation today, you can reference the Louisiana Department of Education's website for the most up-to-date reopening guidelines and resources. Those include self-monitoring checklists and reopening checklists. And if you have questions that we don't get to, we'll make sure to incorporate those in our next town hall and send those to the Department of Education. You can alternatively send your questions to LDOE COVID-19 support at la.gov. And those questions will be incorporated into the dynamic FAQ document that is constantly being updated to meet your needs. Lastly, the Department of Education is continuing to offer Strong Start reopening office hours, and those are every Thursday afternoon, where it's a great opportunity to ask operational questions that are outside of the medical scope that we'll be discussing today. Also, it would be helpful to reference the Louisiana Department of Health's School Isolation and Quarantines Recommendations document. And this really is just a scenario review and takes you through certain situations that might arise once school starts. As far as Children's Hospital New Orleans resources, all schools will have access to our Return to School hotline. That's 504-837-7760. And on this hotline, school nurses or administrators can reach out to a nurse here at Children's Hospital for medical guidance pertaining to a single individual. There's additional access to virtual care through this hotline, at-home symptom monitoring for positive patients, as well as return to school screenings. We'd also encourage everyone to take a look at our website. We have information posted on there for all stakeholders involved that can be really helpful. And then later this week, we'll be rolling out PR and signage toolkits for schools to leverage and organizing a parent webinar. So we'll provide that information to you. Okay, so our speakers today will be Dr. Cade Brumley, the Louisiana State Superintendent of Education, as well as Dr. Tony Gonzalez, who is our COVID-19 guidance expert for our conversation today. Dr. Brumley, before I introduce Dr. Gonzalez and we get started, do you have any opening comments?
Thanks so much for allowing me to make a few comments. I would just start out by thanking everyone for their continued participation in these calls. I know that they are certainly helpful in a time where answers are needed to many questions. Unfortunately, some of the questions that you may have, there may not be an answer to just yet. But we are thankful to have a collaboration with Children's Hospital, as well as our partnership with the Department of Health and other health organizations from throughout the state. I believe that the guidance that we have put out with our Strong Start initiative, as has been validated by medical professionals, is on par with anything in this country. And we're thankful for our local school systems for their work to use that as minimum guidance and develop strong policies from that can ensure that all of our kids are healthy and safe, but at the same time ensure that kids get a good education. So thanks for having me on the call today.
Thank you, Dr. Brumley. We're very grateful for the partnership and appreciate you making time to contribute today. Our next speaker, as I mentioned, is Dr. Tony Gonzalez. Here at Children's Hospital New Orleans, he is our Director of School Wellness. He additionally serves as our Service Line Chief of Orthopedics and is extremely passionate about supporting schools. He's led a successful sports medicine program in the greater New Orleans area and now works closely with Dr. Finger, our Chief Quality Officer, and our infectious disease specialists to support schools. So Dr. Gonzalez, I'll let you have the floor and begin the update on COVID-19 here in Louisiana. And one last thing, I'll encourage everyone to continue to enter your questions through the chat instead of the Q&A option, and we'll make sure to get those questions answered. Thank you.
And let me know if there's any issues. I'm in a new site today, and so if there's any feedback or echo or things like that I need to take care of, just please let me know. We're just going to do a quick update. As everyone is experiencing, everybody's going through this, the COVID-19 pandemic is ongoing. We are seeing a little bit of a plateau right now. We had a large spike in July, and now there's a little bit of a plateau. We're going to have to follow this over time to see what this means going forward. And we really just appreciate everybody's support in going through this pandemic. It really takes a team to move us forward. It takes a team to move our educational group forward, and we appreciate everybody's effort. I also want to say thank you to all the teachers that are on with us today. As if anybody's listened to me before, my mom was a teacher for 30 years. And I don't think you get enough appreciation from everybody. And so just thank you for everything that you do for our kids. COVID-19 is impactful for kids and children. It seems to affect them a little bit less than the overall population. Right now, if you look at our current statistics, the biggest population that tends to be positive is people between 19 and 29. It's about 25% of our overall test results. Right now, the data from yesterday, there were about 10,000 children who have tested positive since we've started testing, represents about 8% of the overall test results. So there are kids out there who are getting sick, and really it's with the protection and utilization of the guidelines that we put forth that helps everybody kind of work through this together. And the things that we want you to remember are really the key points. Stay at home when you're sick, monitor for symptoms, monitor for fevers, wear a mask when you're out in public, both in school and just within the community. Socially distance, stay 6 feet apart when communicating, and wash your hands, clean highly touched areas, but really stay at home when you're sick, wear a mask, and socially distance. These are the things that we're always going to push forward, because we know those items help stop the spread. Everybody asks, how do we know? How do we know that works? After the shutdown, there were multiple areas that have opened back up that have treated kids, treated adults, including medical clinics, hospitals, dental clinics, different areas of service industries, grocery stores. And by implementing a lot of these guidelines, staying home when you're sick, monitoring for symptoms, monitoring for temperatures, wear masks, socially distance, we've been able to decrease the number of outbreaks that we've seen. Everybody's seen the increase over July. We feel that that was just a lot of angst, a lot of people being put in high density situations and not following these guidelines. And so everything we can do, I know at the hospital, our CEO has asked us to be representative in the community for these guidelines. And we would also ask everybody that's listening to be representative as well. When you're out, wear a mask. You don't have to ask other people to wear a mask when you're in the community, but just by showing that you support this and push this forward and staying home and following the guidelines and washing your hands, it slowly creeps into the rest of the community and helps give us the best protection possible moving forward. Next. We want to just go over briefly, and really the key point that I want to talk about is, as we're talking to different schools, everybody's focused on following the guidelines specifically, and there's things that are more important, there's things that are less important, and the most important things you can do is like, and you're just going to be a little frustrated with me because I'm just going to always say it: socially distance, wear a mask, wash your hands, and stay at home with your sick. Those 4 things, if you can do them, really is the best thing you can do moving forward. Everything else, we're going to do the best we can. We're going to stay flexible because there's just certain situations where it just doesn't fit into what we've talked about. And you're going to have to be able to think about the one-offs and stay flexible and work in different situations. And we'll always be available to help you work through those situations. For masks, everybody asked, what type does it have to have? Does it have to be a certain thickness? And really, any fabric face cloth is beneficial. What it does, the viral load, anytime your viral load gets over a certain amount, it's about 48 hours before you become symptomatic. You start expressing viruses in your water vapor that you breathe in and out. And the mask or the fabric face cloths help catch that viral load or water vapor within the mask. There's actually some new studies out that show that the masks actually prevent you from getting sick because they actually catch the water vapor and viruses before you inhale them. And so there's actually 2 benefits. You decrease the spread and it prevents you from getting it. When you take off or put on your mask, you want to take it off from the ears. Do not grab the mask. Is it important that the kids strictly focus on that? I think for the kids that can follow direction, I would encourage it. But in your younger kids, it's more important just to wear the mask and how they take it on and off. For cleaning the masks, if they're fabric face coverings, you want to clean them when they get grossly contaminated, and then once a day. It could be hand cleaned or in your washing machine or dryer. And also, if they're disposable, we want to use them for a day and then get rid of them. Also, if they become grossly contaminated, if they get saturated with either sweat because they're wearing them outside or for some other reason, please switch them out. And most kids are going to have 1 or 2 or 1 extra in their bag when they go to school. There will be situations, most of the kids with asthma, we're trying to switch them over to meter dose inhalers instead of nebulizers so that we're not having to give those treatments at school. And the meter dose inhalers help deliver the medication the same way without any increased secretion of water vapor during the treatments. There will be some kids who can't wear a mask, and there are alternative situations, and we're going to get in those talks in a little bit later town hall. And we welcome you to contact us or your local health provider for any farther direction in those one-offs or those kids with special needs that can't wear a mask. We always encourage you, like I said, to social distance, maintain that 6 feet. Close contact is defined as anybody within 6 feet for more than 15 minutes. And there'll be some special situations that we'll get into a little bit later, but we really want to focus on that social distancing. Remember, as kids tend to congregate, which is what kids do, we want to remind them to stay back. And I really encourage everybody on the call, this is a time to set an example. As adults, the kids are going to follow our lead. If we're wearing masks and socially distance and staying 6 feet apart when we're talking to our friends and the people we see in the street and just saying hello, they're going to do the same thing. They're going to realize the importance and follow along. If we're not, then we're not setting the example we should. And I would just please ask that you do that for us and for the children. Isolation rooms, there's going to be isolation rooms. Oops, sorry about that. My room set off. I didn't move as much. Just a second.
While Dr. Gonzalez gets up for just a moment, I do want to remind everyone, if you happen to raise your hand as a participant, it would be easier for us to see your question if you could please enter it through the chat, and I'll make sure that we get it down. Thanks.
And I'm going to go through this pretty quickly, and we're going to have a lot more time for Q&A at the end because I feel that's really important. And we've already touched on a lot of these things. Isolation rooms, we're going to have one set up. One of the questions is max numbers. We try to socially distance in there. If it becomes too much, you can use another room. Just make sure you clean it when you're done. Physical orientation, we're always going to try to have all the children facing the same way. That just helps prevent spread and maintain that social distance. For physical barriers in the super younger grades, more daycare oriented, there needs to be 6-foot barriers between them if we use in 2 rooms. But as far as the any other physical barriers between students, doesn't help. It decreases the chance of spread, but it's not a remedy for social distancing and wearing face masks. We're going to do symptom monitors. It's just to keep in fact that we want to make sure that we stay home if we're sick. We're going to take temperatures. We're going to ask questions. There's been questions about thermometers, doing consistent readings and the type of thermometers. We don't have to add or subtract temperature. If there is a high temperature or someone getting out of a car or for being outside, just have them sit down for 5 minutes and recheck it. As long as it goes down, they can enter the school. Determining the difference between runny nose and allergies, colds, I would ask that you refer these patients. If there's a concern, then you can pull them out. Have them go see their pediatrician, let their pediatrician evaluate them. The pediatrician really knows these kids better than we do or you do. And so just have them write a note saying, no, this is normal seasonal allergies, and have them come back. We'd rather be a little over than under during these times. And as we move through this, we're going to get a lot better within the first 2 to 4 weeks. Testing, there's going to be testing available. There's a lot of tests out there at this point. If you think you need to test, then you should. If there's any questions about testing or accessibility or children with special needs or non-English speaking families, please call our hotline and we'll be happy to help you through those questions. The biggest issue with cleaning is defining our highly touched areas. For all the schools I've talked to, we have drilled this down. Y'all are already ahead of this, and almost all the campuses and school groups we've talked to have formalized plans and are way ahead of the game in this aspect. So for scenario reviews, why don't we leave this to the end? Let's start answering some questions. We'll give us 5-10 minutes at the end, but I think we're going to go through a lot of this as the questions come up. So let's start going through the questions.
Sure. So why don't we go ahead and cover some more fundamentals around masks. Does it matter if you have a thick mask or a single layer mask? And does a face shield replace a fabric mask?
So face shields do not replace a fabric mask. There are some situations in school where through either speech therapy or didactics or English for a second language, and where you have to watch the mouth in order to get good teaching principles across. When those, we have talked about using face shields, but we're going to especially be careful to social distance during those times. We're going to stay back those 6 feet or even a little bit more while we're doing the lessons. And then if a student has a question, we're going to put the mask back on before we move forward. And so there are certain situations where face shields will be used likely in school, but it does not replace social distancing or the fabric face cloths. As far as thickness, we're saying any fabric covering is a appropriate thickness. And so I would encourage you that if the thicker ones tend to be uncomfortable, more kids are going to pull them down and not use them. And I'd rather have something that's comfortable and them use them than something they pull away. Because if they're constantly pulling it down or pulling away because it's too thick or it's hot, it's not going to be effective around their chin.
And then do we need to have a mask on if we're socially distancing greater than 6 feet?
So what it does, the mask does, is it helps prevent spread. So if you are more than 6 feet apart, then what it helps you do is prevent spread on this computer that I'm using right now. After I'm done with this talk, I'll wipe it down so I don't spread anything I might possibly have to anybody else. And so let's say there's multiple teachers or multiple students hanging out in an area that's going to be used by other teachers or other students. Having the mask on helps prevent any potential spread. And so I would encourage you to do it. You can take it down to eat, obviously. You can take it down to drink. Sometimes you just need to spread apart and pull it down for a second. If that's what you need to do during the day to stay comfortable and wear it the rest of the time, then I'm okay with it. But I would really encourage you to wear it as much as possible.
So you keep it on if you move outside, and you keep it on even if you need to sneeze. Just want to keep it on as much as possible, correct?
That's correct. Now, if you sneeze, everybody has two types of sneezes. I mean, I don't sound funny, but we have sneezes that we're just going to be a little sneeze, and we have a sneeze that's going to be productive. If you think it's going to be a productive sneeze and you only have one mask, use Kleenex. Try to save your mask, and cough, sneeze into your elbow, sneeze into your hand with the Kleenex. Go wash your hands afterwards. If your masks do become grossly contaminated, you do need to switch them out. So if something happens and there was one sneeze and you thought it was another, just try to find a disposable one to use till the end of the day.
What about teachers that are speech therapists or teachers that need to be able to demonstrate their mouth?
And that's kind of what we're talking about. There's been multiple things that have come up. One is that people are using plexiglass shields in front of the classrooms. Some people are using face shields during those didactic discussions. Again, we want to make sure we maintain those social distance. If we do have to move closer, we want to put on a mask, and then we want to wipe things down after we're done with those discussions or didactic lessons. I think it's a event where we're doing the best thing possible with still some protection, but not the best thing we could, and it's just appropriate for that situation.
Where else could we use partitions? And then what would you suggest how often we should clean those?
So if we use partitions, we can use them in large areas. Like, let's say we have a gym and we're going to put 2 PE classes, and we'll need a partition down the middle so that we're keeping those groups separate. You can use partitions again in daycare or very young situations, but they have to be at least 6 feet. You can use partitions. Let's say most of the people are going to use cafeterias where the food's brought to the schools, but if there was a situation where somebody like at the administrative assistant's desk or the school nurse, that they were in contact with a lot of people at one time, they may have a partition as well. If it's touched by a lot of people, it needs to be cleaned the same as any highly touched surface. If it's not touched during the day, then you would just clean it as you would all the other objects at the end of the day.
And one last question about masks, and we'll move on to another subject. Do students need to have them while they're being physically active, so at resource or PE?
It depends on what your groups are, and so I'm going to use a discussion or a name from the NOLA public schools. They use static and non-static groups. Their static groups are groups that stay together all the time. Their non-static groups are groups that intermingle, and so your younger kids are in the same group all the time. Those are cohorting groups. Those are the ones that can't maintain social distance, and those, when they're recessed, we would encourage them to wear a mask. We would encourage them to social distance, but if they don't stay quite as, they're not always compliant, it's not as big a concern because they're not socially distancing within the classroom. In those groups that are not cohorting and they are intermingling, we really want to encourage them to wear a mask, even in PE if possible. If they're outside and it's extremely hot and they're having some concerns, just make sure they spread out. As long as they're spreading out for those 6 feet, masks, again, if you're outside, they don't change your social distance protocols. And so there are some situations where you can pull them down and they can get some relief, but just make sure they're 6 feet apart.
And then one more time to emphasize, grades 3rd and above are encouraged for mask wearing, correct?
That's correct. So we're recommending, and I think it's required, that all kids 3rd grade and above wear masks.
Okay. And then I know that we are going to spend some time elaborating on special needs children or children with disabilities on another town hall. But can you talk about what we should do with kids that have asthma or maybe are on the autism spectrum and cannot wear a mask?
So we're going to try to find something that works for them. So in the hospital, we have these kids that come see us all the time. And what we found is we're going to work with the families that bandanas tend to work better. The buffs or the gaiters that are a little bit lighter material tend to work a little better. And so we're going to do everything we can to work with these families so that there is something that they can use. If there's absolutely nothing that they can use, then we're going to try to maintain that social distance. For the caretakers that are taking care of them, we'll ask them to wear masks, wash their hands more closely. And also, if the assistant who is taking care of them, if that patient ends up having to isolate, then they will self-quarantine. And so we'll just have to work through those. Those are really going to be one-offs. We'll get into a lot deeper during the town halls for those kids, and we're going to help you through this. I mean, we are here to answer these questions. If you're having a question, there's 100 other people who are having the same question, and eventually we'll make it where everybody's on the same page and we're working through this, and it flows seamlessly and it's smooth, and so we'll get you there.
What would you advise if there's a teacher that has a medical reason and a physician's support not to wear a mask? Should that teacher do virtual learning? Should the parents be informed?
That teacher, we would ask that they did virtual learning if possible. If not, and they cannot do virtual learning, then socially distancing them from the kids would be more important. So maybe having them in the front of the room. I think we would want to work with the school to find out what the best scenario with that would be, and if there are some things we can work out in that specific scenario. But it's going to be more that they're going to have to stay in the front of the room. They're going to have to do more didactics. They're going to have to do one-on-one teaching more from the front of the room than at the desk. And so we'll have to work through that a little bit.
Okay. As far as scenarios involving the isolation room, would you advise having someone man that isolation room while there's another person tending to other children?
So I think that you don't necessarily have to man it. I think in most situations that I've seen, there is somebody that has the kids and can see them and can monitor them. And I don't think that any of the schools will put a kid they're concerned about in there unmonitored. So this would be the kid who just has symptoms or there's concern or has a temperature. It's not someone that needs immediate medical condition or attention. And so with those kids, the person can come out if they need to after they've removed their PPE and washed their hands, either gotten a new mask and take care of the other kids until the parents can come. If someone has to stay in that room, then yes, somebody else will have to help with the kids to come in for first aid. And I believe we're going to have a little bit of a town hall or webinar just to kind of, there's going to be a lot of unity with this. It's going to be a lot of teamwork and people who step up and fill roles. And we're going to do a town hall or webinar, just a first aid for non-medical personnel. And we can put that out there to help people through those situations as well.
In that isolation room, if there needs to be more than one individual, do you advise using a barrier? And if so, what kind? And if the barrier is in place, do the participants have to be 6 feet apart?
So we want to always try to encourage them to be 6 feet apart. If you can't, I'd rather all the people with symptoms be in the same room. We want to have them in a mask with a mask on. And so the barriers aren't as critical in those situations. If you have them, it's better, but it's, we'll always talk about there's things we have to do and there's things that help. And if you can do them, and if not, it's not as critical. The barriers are that not as critical. They help. And if you have the access and the resources, you can put them in, but it's more important just have them in there and put them, a mask on them and then have them out of the facility as soon as the parents come.
Okay, why don't we go ahead and consider 2 scenarios between someone who might be exposed and might not be exposed. So if we start with identifying a known exposure, can you help us understand what exposure means?
Sure. And so exposure is, so there's 2 things that we kind of want to think about. One is I have symptoms and I go get tested or I refuse testing. So anybody we're saying that has symptoms and refuses to go seek medical attention or refuses to get tested, they're going to be presumed positive. And then if someone has symptoms and they come back positive, then they would go into isolation. So isolation, and the biggest questions we've had is what's the difference between isolation and self-quarantine? One's 10 days and one's 14 days. Well, there was a pre-period in that before the person became symptomatic where the virus built up enough in the It'll kick back on in a second. There you go. Gotta love technology. There's a pre-period where the virus builds up that lasts for about 4 days. In those 4 days, the virus builds up enough load within your system to make you sick. So you had 4 days, and then you have the 10 days after. And if you add those together, that's the 14 days for the self-quarantine. And so people who are self-quarantining aren't necessarily symptomatic, so we have to include both. And so getting back to our scenario, if someone is positive, presumed positive, then they will be out for 10 days from the onset of symptoms. They have to be afebrile for 24 hours, and they have to have decreasing other symptoms. That allows you to get back. If you are in close contact, which means if you've been within 6 feet for more than 15 minutes, then you will have to self-quarantine for 14 days if you've been in close contact with anybody that's positive or presumed positive. The CDC has added in that if you've touched or come in close contact or shared anything, what that really does is it adds a little bit to it. And what that means is if I was in the hospital and there was a kid that was crying because we were having to do something and I had to console them and I was in close contact and they either cried on me or I got grossly contaminated for some reason, then that would be considered a close contact. And so as teachers are in the rooms, it just gives you a little bit more leeway to rule in and rule out people who are in close contact. And so if that situation comes up, I would ask you to contact us or the Office of Public Health to help you work through that and to figure out who's in close contact and not, if you're using other means besides this 6 foot for more than 15 minutes.
There's been some ambiguity around exposure. No, it's simple when we say if you're within 6 feet of someone for 15 minutes, does it matter if you had a mask on?
It does not matter if you have a mask on. Like we said, the mask keeps you from spreading it. It prevents you from getting it, but it does not eliminate what a close contact is, or doesn't change it at all. But remember, if you're wearing a mask and you're in close contact, it's going to keep you from getting sick and potentially spread it to other people. And so it's still a good reason to wear it, but it doesn't change who gets self-quarantined and who doesn't.
So if you've been exposed and you test positive, then you move into that isolation period, which more or less relates to that 10-day.
Well, 14-day.
14-day.
I'm sorry, if you test positive, it's 10 days. I thought we were talking about self-quarantine.
And then if you test negative, that's more of a quarantine. So the difference between isolation and quarantine is the 10 to 14-day discrepancy based on a test result.
Well, and also just anybody who has, anybody who's been in close contact, whether you test negative or positive, you're going to be in that self-quarantine for 14 days. You cannot test out of self-quarantine. And we've had multiple questions come up where someone was in self-quarantine because they had a close contact with someone who was positive, and they said, I have something I have to do. There's been multiple school functions that have come up that they want to participate in because they weren't allowed to participate in before. And so they've said, can I test negative and go participate? And the answer is no. The 14 days for someone who's close contact is a hard stop.
And what if you have COVID-like symptoms, but you still tested negative? That's still some type of period to rest at home, right? But it's not necessarily a full quarantine period.
That's correct. We would really encourage everybody who is having any symptoms during these times to go to their PCP or medical provider. This way they can just look at you. There's going to be everything else that we go through during the fall and winter: allergies, strep throat, flu. And so it gives you a chance to go be seen. And it's really important to be seen because all these other things can cause problems too. And you want to get the appropriate treatment. And so even if you test negative, you're still having symptoms, please be evaluated. Also too, that will help us monitor those symptoms, because if you're in contact with your pediatrician or your primary care provider and you're still having symptoms, then they may ask you to get retested. There may be something else going on that they need to evaluate you for, and then they're going to guide you through that return to school or return to work criteria, either with a note or symptom-free or some criteria moving forward.
How about if you identify a student with a runny nose? Is that something that should be concerned, or again, is that a situational?
So it kind of goes back to what the big symptoms are. And so the studies show that three symptoms occur in almost all positive patients. That is fever, shortness of breath, and/or chest pain. With that, people can have headaches, malaise or fatigue. They can have a dry, increasing cough, and they can have congestion. This is South Louisiana, or this is Louisiana. There's a lot of allergies, and people tend to know whether they have allergies or not. I would encourage all the school administrators, school nurses, school teachers, that if there is a concern, have the parents contact their primary care provider. I promise you, the primary care provider has dealt with allergies before, and they can help guide the parent, say, listen, no, this is seasonal allergies, and write a note back to the school. If a lot of these kids are well known in the school, they've known they've had allergies last year, this is just them, it's the same symptoms, and the school nurse is going to kind of help you through. But if there's any question, just refer them to their primary care provider.
What if a teacher gets sick? Does that teacher need to have 2 double negatives in order to return to a school, or do you think finishing the quarantine process and improving with symptoms, or excuse me, the isolation process and having their symptoms improve is enough?
So there's 2 criteria to come back that the CDC has put out. One is a time and symptom criteria, and the other one is a testing. Right now in Louisiana, we are not using the 2 tests to come back. We are using the time and symptoms. It's a function that we think that there is a potential false negative rate, and we feel more comfortable with the time symptom to prevent spread because we are a high transmission state right now, or have a high per capita rate. And so we are using the time symptoms because we feel that's the best thing to prevent spread at this point. If it changes, we'll let you know. But right now, we are using the time and symptoms. If you're symptomatic or you test positive, it's 10 days from the start, 24 hours afebrile, and decreasing symptoms. If you're self-quarantining because you had close contact, it's 14 days.
We're getting a lot of questions, presumably from nurses that are concerned about being around kids that are sick. So if a nurse is manning an isolation room, does she need to change her mask or her gloves in between that isolation room, or what's the PPE recommendation for those situations?
So you don't have, no one touches the mask but you, and there's a kid that's not touching it or pulling on it, you don't need to change it. If it becomes grossly contaminated, a kid coughs on it or sneezes on it, then I would change it out. I would change gloves anytime you go in and out of the room, but the mask you can keep on. I know there's a lot of concern among the school nurses about that isolation room and dealing with kids who are potentially symptomatic. We actually see a lot of kids come through the hospital. Georgia Tech actually put out a very good algorithm that shows, potential positives. And with that, in our hospitals, in our dental clinics, in our other medical clinics, even treating potential positive patients, by masking, by washing our hands, by maintaining social distance when possible, we've been able to prevent any outbreaks within those areas. And so I know the school nurses are concerned, and every person in our hospital is concerned about the same thing. But by following those guidelines, you really minimize that risk.
Okay. And can we continue on with some more scenario analysis?
Sure.
You're a teacher or a nurse and you have a child who is sick at home with COVID-19. What do you need to do? Do you need to isolate or quarantine?
So there's 2 scenarios that we need to kind of go through with that. So you're a nurse or a teacher, you have a child that's positive or presumed positive, then you are a close contact and you have to self-quarantine 14 days. If you have a child at home that's self-quarantining, that means they are asymptomatic, but they've had a close contact with somebody who is positive or presumed positive, then you do not. Contacts of contacts do not have to self-quarantine. So let's say my daughter was friends with another person, that person comes back positive, my daughter has to self-quarantine, then I do not have to self-quarantine unless my daughter becomes symptomatic. As soon as she becomes symptomatic, she needs to be tested. I will self-quarantine until that test comes back. If she is negative, then I get to go back to work. If she's positive, then I self-quarantine for 14 days.
So what if there's a child that's identified at school that has symptoms and we're sending them home to go get tested? What if that child has a sibling at school? Should that sibling be sent home as well? Or should we wait for a positive test result?
So as long as they've had no contact with a positive person that the family knows of, then we wait for a positive test to come back. If they said, oh, come to think of it, you know, Johnny down the street, he had a positive test, they probably got it from him, then you probably need to pull the sibling out as well. And so I think as long as he's symptomatic, there's no other positive contacts, and they should, you know, that they know of, then you don't have to pull the sibling out. You can wait for the test to come back.
So would a fever be the biggest sign in that situation, or what are some of the symptoms that are the biggest red flags to say we need to send you home?
So it's fever, shortness of breath, and chest pain, but also too GI symptoms, loss of smell and taste, and cold-like symptoms or malaise or fatigue are the other ones that you want to keep in mind. But so I would kind of put them in tiers. I would say fever, shortness of breath, and chest pain are the top tier. Then you have malaise, loss of sense or smell, GI symptoms, and then cough as well would be the next tier. And then the congestion, runny nose, things like that would be, sore throats would kind of be the last. And I'm not discrediting those symptoms, but there's just a lot of things within the air, within allergies, within other pathogens that cause those symptoms. So the farther down the list you go, the more confusing it gets and more possibilities for other things.
And there's been several questions coming in, continued analysis around whether to isolate or quarantine. And I do just want to emphasize that Children's Hospital New Orleans is working with our local Office of Public Health to put together an algorithm or a decision tree that school nurses can reference that really just emphasizes everything that we're talking about today. It's very high level. I think will be a useful tool. So we're going to get that out to you as soon as we can.
And we understand too that, I mean, we're talking about it all the time. This is all we've talked about for the past 6 weeks. And so when we're saying we'll help you through this, we really will. And I promise you, the more you think about it, the more you get into it, the more intuitive it gets and the easier it'll be for you. I know you're very concerned, just as all of us at the hospital were concerned when we had the shutdown. But then as we moved through those first 2 weeks, as we started living it and working through those scenarios, it started getting easier and easier to deal with these situations. And we will be here to support you as much as we can. We will help you through. We will answer all your phone calls. We will answer all your emails. We will get you through this piece. And so don't feel like you're going to be on an island. We and all the other medical community are here to support you.
We have continued questions coming in about nurses, specifically those that have to travel to see multiple campuses. What would you recommend as far as PPE in and out of isolation rooms? I know we commented on this, but if we could hit on that again.
Sure.
As well as PPE in between kids that are positive for COVID-19 and kids that are healthier.
And so we would ask that you do the same things that we do at school. So I don't think you're going to know if somebody's positive at school. I mean, the quickest tests we have are 45 minutes to an hour, and those aren't readily available. And so what we're talking about is people who are symptomatic. And remember, about roughly right now, 8% of the people who get tested come back as positive. And so most of these kids are probably not going to be positive. They're going to have other things. And so with that, we want to treat everybody like they would be, and we want to wash their hands. I mean, there's nurses in the isolation rooms and people with known positive cases in the hospital, and this is what we do. We go in, we wear our masks, As long as we're not doing an aerosolizing procedure, we don't wear N95 masks. We just wear regular masks. We, if someone's actively coughing, we wear a gown or some kind of protective device. If they're not, you don't necessarily have to. We wear gloves. We go in, we take care of whatever we need to take care of in those rooms. When we come out, we take off our gowns, take it off from the back forward. We pull our gloves off. We wash our hands. As long as our mask is not contaminated, we wear the same mask and then move on to the next one. And so that's how I would approach that. I would encourage, if you go into multiple schools, that you try to limit your contact as much as possible. It's going to be okay in the high school. You're going to be able to do that. In the lower grades, you may not be able to do that as much. And just be honest, if a kid comes back positive and you've been in close contact with them, we're going to ask you to self-quarantine. And the more honest you are with us in those situations, the more we prevent the spread and we can help move you forward.
And again, so if a nurse spends more than 15 minutes within 6 feet of a student that then tests positive, that would be a conversation about quarantine.
It would be a conversation.
Isolation.
Yeah.
Okay. What scenario would involve an entire class that needs to be sent home because of a positive case? We have a lot of questions around that.
So the Office of Public Health we talked with them yesterday, our local leader, and they want to be involved in all the classroom discussions. But if they have 2 people that are positive within one class, then there's a chance we may shut that down. And I want to reiterate that there may be a chance, because if we talk with the Office of Public Health and they do their contact tracing and it ends up that there was just community spread and just happened to be those 2 people and there wasn't spread within the school, they may choose not to shut that class down. It'll depend on if there's close contact within that school. Is this a cohorting group or a non-cohorting group? And so we're going to work closely with the Office of Public Health. They've been asked in any situation where the class can be shut down or the school can be shut down, that they be informed to be integral in that discussion. But if there's more than 2 in one room and it appears to be spread from within the classroom and not community spread, then there's a chance that class may get shut down. If there's multiple classes that are shut down, there'll be discussion with the Office of Public Health, and there's a chance that school may be shut down and go to virtual learning. But all those discussions will be decided by the Office of Public Health.
Okay. And so we'll move away a little bit from the nurse's office and isolation rooms. I know we've been talking a lot about that. Getting back to the classroom, do teachers need to be wearing gloves if they're assisting smaller children or kids with backpacks or the carpool line or anything like that?
No, just remember to wash your hands often. And, hand sanitizer works as well. If you wash your hands with soap and water, it needs to be for at least 20 seconds. If you use hand sanitizer, it needs to be at least 60 to 70% alcohol. There have been some recalls of the methanol ones, but for just regular ones, and this majority of the ones out there, just make sure you use it. And really, it's kind of like one of the other things we talked about with testing. If you think about it, you should wash your hands. Anytime you come in contact with somebody else, you need to wash your hands or sanitize them. Anytime you go through a door, anytime you are about to eat, change your mask. Basically, anytime you think about it, wash your hands. And that's really the way to kind of keep it clean.
Is there a strong difference between physically washing your hands in a sink versus hand sanitizer? There are schools that are concerned that they have more hand sanitizer available than sinks.
No, that's fine. The hand sanitizer works just as well as the sinks.
Okay. And getting back to masks, if there are masks with vents on them or masks that are clear that you can see through them, do those work just as well?
So the ones that you can see through, I imagine, unless they're well ventilated, they're going to fog up pretty quick. And so there's going to be some that have foam on the side that allow the air to come out, and those may be beneficial in some of the didactic learnings. The mask with the vents, there's been a lot of hearsay about if they're good or bad. If they're able to wear it and it's comfortable for them, I would encourage them to wear any fabric face cloth. There's no difference between a fabric face cloth and one with a vent. And so if they're wearing it, I would encourage them to wear it.
Okay. And then can we touch on how to focus on high-touch areas within the classroom and at what frequency they should be cleaned, whether that's while the class is in the room or in between classes that change?
Well, it's going to be different for different schools. The majority of schools are going to probably change and have someone clean it in between changes. So like when they go to recess and the kids come in, they will clean the playground equipment while there's kids not out there. In certain classrooms, when they go to recess, they will go through and clean them while they're at recess, because there needs to be a little bit of a dry time for the whatever you're using to work. And so in order to have that dry time, there'll need to be a period where it's not touched. And so most of the time it's going to be done when the kids aren't there. There will be situations where things will have to be wiped down, things will be contaminated, and you'll have to do it when it's there. But I'm imagining that most of the time it's going to be done when the kids are in other rooms.
How about cleaning carpets or floors that have a bunch of young children crawling all over them?
So right now, it's a little controversial, but after we've talked with everybody, we are not considering floors and carpets highly touched areas. And so they would be cleaned like you would regularly clean them. They still need to be cleaned, but they don't necessarily need to be cleaned every 2 hours or 4 hours. I understand people's concerns. I understand that kids are ornament and crawling, but the majority of those kids that are in that situation are going to be cohorted anyway. They're going to be not able to be socially distanced. And so they're going to be in close contact, and it just kind of creates a family situation. When we discussed it with schools, those classrooms are becoming a family. And it's going to be those 10 students or 15 students and those 2 teachers, and they're going to do the best they can. They're going to hand wash. And kids younger than 2, they're not required to wear masks. And the kids 3 and under, they don't have to wear masks. Or the 2 and under don't wear masks. Kids 3rd grade or 2nd grade and younger don't have to wear masks. And so they're going to be more cohorted. And so we've just determined that the floors and the carpet aren't as critical as other things.
And getting back to the definition of exposure, does 15 minutes mean accumulation, or does it need to be 15 minutes straight?
15 minutes straight in one situation.
Okay. And how should teachers and school staff handle faculty meetings and group assemblies?
So more than likely, most people are going to do it within the classroom or homeroom. And so you're going to do it over an intercom, for most of the situations, like you used to have an assembly in the beginning, then they would do it within the classroom, or they would do it in one area and discuss it there. Now that all the kids are going to go to a classroom or homeroom, and the discussion is going to be held over the loudspeaker.
Okay. And there's been several questions that have come in around what if there's a student that is suspected of maybe having COVID-19 and the parents aren't responding. So maybe the parents aren't taking them to go get tested, or maybe the parents aren't even picking them up from the isolation room.
So if they can stay in the isolation room all day, it would be beneficial if they did pick them up, but we know there's going to be situations, and it may not even be that the family is not responding, they just can't. They're working, they're not allowed to have phones at their work, whatever reason it is, they're just not responding. The kids can stay, but as soon as the parents pick them up from home or at the end of the day, they can't come back until they've been evaluated by their PCP. The other situation is, what if they won't take them to get tested? They're symptomatic, they won't take them to get evaluated, then they're presumed positive. So then they fall into the positive profile and they have to isolate. That means they can't come back for 10 days from the start of the symptoms. They have to be afebrile for 24 hours, and they have to have decreasing symptoms in order to come back.
Okay. And I know we're getting tight on time here, everyone. So for all the questions that we haven't gotten to, we have all of this recorded, and we'll make sure to have that posted again on the FAQ dynamic document. But why don't we spend the last 5 minutes, Dr. Gonzalez, focusing on COVID-19 as a disease itself. So what research and literature do we have that discusses how students can transmit this to adults and vice versa?
So it's all transmitted the same. There's not a difference between kids and adults. There was one article done that showed that the transmission rate in kids younger than 10 was less than kids over the 10 or 10 and over. This hasn't been followed up. In the medical world, we like for multiple studies to say the same thing before we come out, but there was that one article. it's transmitted through water vapor. There is virus that builds up and within your throat and your lungs, and as you speak, water vapor comes out. We all see it on a cold morning. In that water vapor, there's virus particles. People breathe them in. In a couple scenarios of outbreaks, there's been areas where people weren't wearing masks and there was loud singing or cheering or rowdy nature. And in those instances, there was a lot of people in one spot congregated, and they were all loud, and so they were all breathing in the same, and that's how it spreads. It's not necessarily, like I said, different. We do seem to be a higher percentage right now in the 19 to 29-year-old group. It's just the fact that 19 to 29-year-olds tend to be more social. They go out, they're involved in more activities. We've seen it all kind of come up recently with vacations and beaches. We think some of the spreads related to high density areas. What happens at the beach? You're in a hotel or you're in a condo situation. You're in high density elevators with people going up and down. You're touching the elevator buttons in highly touched areas. People aren't necessarily wearing masks. They're talking loud. And these areas where you're in high density situations where there's a lot of people breathing and talking and communicating and potentially being loud are the highest risk for transmission. Like I said, I don't think it's different for kids or adults. And I think that if we know through the way we work our medical clinics, our dental clinics, our first line responders, our hospitals, wearing a mask, being social distance if possible, washing our hands, staying home if you're sick, all of these scenarios help prevent spread.
All right, well, we'll go ahead and close with that unless you have any final comments, Dr. Gonzalez.
No, and we'll go through all the chat. We'll make sure we answered any questions. We don't want to feel like we left anybody out. And I just can't reiterate how much I appreciate y'all's support and what y'all do. And I know y'all are very concerned, and I don't want to be, I want to support that concern as much as possible. What we like to do and what Kimberly are set out to do is try to go through all these questions as much as possible, provide as much forum out there in education so that you're as comfortable as possible. I don't know, we're going to do the best we can to make you as comfortable as possible to go back and do your job so that you really can affect these kids as much as you do. I mean, I don't think just talking to my mom, it's really the little things. Y'all have affected more kids in their lives and their future function and their future ability than y'all know. And so all we want to do is help y'all get back so you can help these kids.
Thank you, Dr. Gonzalez. Thank you, everyone, so much for joining us today. As we mentioned, this is recorded and will be posted online. We're absorbing all of these questions, and we'll make sure that all of the resources we mentioned that are coming out this week will get to you as soon as possible. We'll go ahead and end on a quick video we just want to share that might be helpful to share with your students or parents, really just COVID-19 information for kids, by kids, and then we'll go ahead and finish after that. So I'll go ahead and put that on.
During COVID-19, and how many of you are confused by the ever-changing rules? Well, today I'm going to set the record straight on a few very common COVID-19 questions, because after all, us kids want to be in the loop too. The first tip I know is to avoid touching your face. It's just like when someone has the cold or flu. You know they're spreading germs by sneezing or coughing, so you avoid touching your face then. It's pretty much the same now. We just don't want to touch our faces regardless of if we think they have the coronavirus or not. Also, wash your hands thoroughly. I know this one's been a constant reminder during COVID-19, but it's important if you want to stay healthy. The CDC says to wash your hands for at least 20 seconds or even longer. I like to do a little song and dance when I wash my hands. With school around the corner, I'm curious to know what's going to happen with each of our classes. It sounds like there are going to be fewer kids in each class because smaller groups help stop the spread. Since it's easily spread through close contact, though, it's important we keep our desks at a distance and avoid large groups, so there won't be any pep rallies for a while. Depending on the school, we might be packing our own lunches every day. It's about what each school feels is the safest measure to take. Cafeteria-style lunch gatherings probably won't be happening for a while, which means we're more than likely going to be eating in our classrooms. Face masks may also be the new accessory with our school wardrobe. Cloth face coverings are essential when physical distancing is difficult. And if you have a creative aunt like me, your face mask might look a little funky, like this. It's just important that you wash your masks each day like you would your clothes. Now, let's talk health checks. Some businesses, such as Children's Hospital New Orleans, require you to get a quick health screening when you come in for a visit or report to work. Now, this isn't as scary as it might sound. They literally take your temperature and ask you if you've had a sore throat, coughing, or a fever, and then they give you a face mask to wear. They also have hand sanitizing stations so you can clean your hands and be on your way. Now, schools will most likely do this too. And I personally love to be on the safe side, and I'm happy that we will be screening everyone coming in. After all, we are ready to kick COVID to the curb. Thanks for hanging out with me today, and if you need any more videos or up-to-date information, you can find it on CHNOLA.org. That is CHNOLA.org.